So we can freeze the ovary tissue because all of the eggs, the real heart of the ovary, are located in that outer little thin shell, which we call the cortex. What we find is it's so thin that we can remove it and we can transplant it just like a skin graft, and it takes and you have a new ovary. We can freeze it easily because it's thin enough. Again, you can freeze it just as though it were a skin graft. And we developed a better method of freezing it now, which is vitrification. And the vitrification will allow us to freeze that whole ovary basically with no loss of eggs whatsoever. So it's a preserved, perfect ovary. So we can use this for cancer patients. They're going to have their ovary destroyed anyway with their treatment. So if we take out one ovary first, I'll tell you why in a second, we leave the other ovary in, and we can freeze it beautifully with no damage as tissue. And then when they're cured of their cancer or they are ready to have children, we can unfreeze, we can thaw that tissue and place it right back on the old ovary that's been killed, that we left in there. It's been killed by the chemotherapy. And we can place it back on there like a skin graft, and it works. It's just amazing. She's got a brand new ovary. And then there's another use to it that's spectacular. Many of our cancer patients told us how lucky they felt they were that they had cancer, which is weird. But they said that because their girlfriends at age 35 are worried about their biological clock. But they've got 17 and 20-year-old ovaries in the freezer, and so we transplant it back, and it's a young ovary. So therefore, this is also a good way of preserving fertility for young women who need to put off childbearing.